Nisa Martinez, and this is my flashcard. So 5 important external structures that one can observe on the body surface are the muscles that I'm about to show you on my model. Model could come out. So the first one is the trapezius muscle, and this is a muscle that positions the pectoral girdle, and we can see that here in my model. It is this muscle right there, okay? And this muscle can rotate the scapula or the clavicle. It can elevate and depress. It just depends how you are using it. The next muscle is the deltoid, which we can see here and in the back, right here. As well, we can see that he is flexing his deltoid muscle right there. And the deltoid muscle is a muscle that moves the arm. Abduction of the shoulder is the action of the whole muscle. Next, we have the biceps brachii. Model could show us his biceps right there, right here. All right, so the biceps are flexors. We have flexion at the elbow and the shoulder, and supination of the forearm and hand. Next, we have the brachioradialis, which is this muscle right here. We can see that it's moving. A little closer. Right there. That is the brachioradialis, which is also a flexor. It's flexion at the elbow. And then the last one is the triceps brachii, which are right there. We can see as he's flexing it. And these are all muscles that move the forearm and hand. The triceps are actually extensors. There is extension at elbow and extension and adduction at the shoulder. Okay, thank you, model. And so those are 5 structures, and all of those external structures are a part of the muscular system. That is the body system that they all belong to, is the muscular system. So the importance of surface anatomy is that, first of all, it helps us better understanding in human anatomy, and it helps us describe locations. As you could see here, if patients were to be having problems with anything, we would look at what body structure and diagnose them. So it also is important because it helps us diagnose and treat patients. It's also important because we can interpret medical images once we know where structures are found in the body. 2 clinical applications of the 5 structures that I just mentioned would be diagnosis of any injuries that happen in those muscles, like tears, strains, anything like that. An example is bicep tendonitis, which is inflammation of the upper muscle, and its causes are repeated overhead motion. So that causes inflammation and can cause pain. So knowing where the biceps are could help a medical professional treat that patient. Another one is muscle knots. Its most common place is in the trapezius muscle, and that is caused to stress and poor posture. So knowing where those structures are in the body can help a medical professional diagnose the patient and treat them.